This week, Luigi Mangione, accused of fatally shooting the CEO of United Healthcare, Brian Thompson, was charged with 4 federal criminal counts, including 1 for murder, which could carry the death penalty. These charges came days after the Manhattan DA's office filed 11 state charges, including first-degree murder in furtherance of terrorism. Despite the stark violence and gravity of the charges, the public's reaction has been mixed, with some people sympathizing with the suspect. The killing, while wrong and tragic, has sparked a complex conversation, though, about the healthcare industry and who exactly it serves. Joining me now is Dr. Sachin Jain, the CEO of SCAN Group and SCAN Health Plan, a California-headquartered Medicare Advantage plan with more than 300,000 members. Dr. Jain, thank you so much for joining the show. I want to let our viewers know you have a very unique point of view here. You're a practicing physician. You were a senior advisor to the administrator for the Centers for Medicare and Medicaid Services at the U.S. Department of Health and Human Services. And now you're the CEO of a not-for-profit health plan. According to the feds, Mangione had a notebook on him when he was arrested. Inside it, he wrote, quote, "The target is insurance." Federal prosecutors allege that Mangione did this in an attempt to spark a debate over insurance industry practices. Do you think insurers are now listening?
I think everyone's listening. I think we're in a moment of reckoning right now, Katie, where there's a greater realization that people are unhappy, they're frustrated, they're angry with the state of U.S. healthcare. And I think all of us who work in healthcare are starting to begin to look inward and ask the question of why, and more importantly, how do we move forward with solutions? This has been a very challenging time for everyone who works in healthcare, and it's not just in insurance. I think people who work in the health system world and the pharmaceutical industry are beginning to take a look at what it is that they're doing and how it's impacting people. And I think now's a big moment for change, and I'm hoping that this will be an inflection point for U.S. healthcare.
You know, Dr. Jain, you've been very vocal about your thoughts on the healthcare industry. You recently wrote a really good article in Forbes saying, quote, "Policy discourse increasingly reflects the perspective that health insurers are an obstacle, not an enabler, to a functioning healthcare system. Rather than being counted on to do the right thing, health insurers should be subject to intensive regulation to protect the public." So we've got to look to legislators, though, to fix this broken system. They can't kind of self-regulate or self-fix.
Yeah, in that article, I was reflecting on the fact that really our perception of insurers will actually shape, how we treat them in the public sphere. And I actually don't think that we should be looking to regulators. I believe it's time for companies to act and to solve the problems that, frankly, have been normalized for far too long. People experience waits and delays in their care. People are subject to high deductible health plans and don't necessarily know what their health care costs will be. This is wrong. And I think, those of us who work in healthcare came to work in this industry to try to help people. And, what we find ourselves in is in a Frankenstein healthcare system where we aren't necessarily doing the thing we set out to do. And so I believe the work begins today to begin to look at the practices that are causing frustration, that are causing people challenges. And we have to begin to acknowledge that we are all part of the problem. And so I don't believe that it's, the job of regulators to fix these problems. But I do think that, we're an industry that has, frankly, been successful without necessarily being as good as we can be for the people that we serve. And I think most people who work within healthcare would tell you that they believe that they're doing the right thing. But again, I do believe we've normalized a lot of practices that, frankly, don't serve the interests of people. And, as a healthcare consumer myself, as a physician, as a leader of a healthcare organization, I believe, the time is now to make real change.
Well, I'm glad that you bring up the timing, because obviously, as you've heard on my show so far, and as we obviously know, we're going into another administration starting in January under Donald Trump. You also wrote a great piece for Forbes with your predictions for 2025, including this, what I thought, startling statement, quote, "The health equity field as we know it will end," citing Vivek Ramaswamy's post on X/Twitter, whatever you call it, saying in part, the latest HHS budget request mentions equity 829 times. Time to doge it. I mean, Dr. Jain, the Biden administration's healthcare initiatives focused on health equity, as you've noted. Isn't this what this whole public outcry is about that's come from this Luigi Mangione murder case? Isn't the idea of equity, affordability, and the understanding and the empathy that should be in one of the most important spaces, which is health and health care? I mean, isn't that what this is all about? And so, I mean, should there be any optimism going into 2025 about what this industry space is going to look like?
Look, I think that there's been a major focus on health equity over the last 4 years. And I think, companies like mine are going to continue that focus because it's the right thing to do. But at the same time, I don't know that, to your point from our previous exchange, I'm not sure we're necessarily going to be able to look to the federal government to set the table around a health equity agenda. I think it's going to need to come from health system leaders and health plan leaders in the private sector who continue to believe that these are really important topics. And that's, where we're going to, maintain focus over the next several years.
Dr. Sachin, I was going to say goodbye, but I actually wanted to bring up very quickly a graphic, and I wanted to have our director bring it up. It shows in 2023 that United Healthcare was the leader. And you can see it on your screen, hopefully. The claim denial rates by health insurance companies, 2023, they're major ones. United Healthcare is the one bar on top. It's the highest one. It's the highest denial rate. I want to be very clear. That is not justification in any capacity, Dr. Jain, for the crime that was committed by Luigi Mangione. But it's something like that, I think, that's spurring the reason why you're writing what you're writing and why you're speaking out the way that you are, so that people can have a better understanding that this blame game has to stop.
Look, every health insurance company has some form of prior authorization. Our perspective is that medical groups themselves should actually own responsibility for making decisions about people's care. Doctors, should be in the driver's seat. And I think there's some payment models that will get health insurance companies out of the business of approving and denying care and put more and more responsibility in the hands of physicians and the medical groups that they're a part of. And that's the direction that we need to move in. I don't think health insurance companies should be gatekeepers. I think we should be enablers. I think we should be advocates. And I think that's the future of this industry.